Good afternoon, everybody. At the outset, I would like to thank the organizers for giving us this opportunity to present about our HIV/TB care integration facilities in India. Myself, Dr. Aarti, would be starting off with the presentation, followed by Dr. Sangle, who will take over and give details about the actual integration program. As we see, the HIV burden in Asia Pacific region varies between 0.2 to 0.9%. However, if you look at the absolute numbers, because of the population, it comes to over 5.9 million cases in the same region. Coming to India, we have about 2.1 million people living with HIV with a prevalence which is low as 0.2%. With not much data available on the children who are on antiretroviral treatment at present. We know that tuberculosis is the deadliest infectious disease with around coming in the 10 top causes of death globally, and it has surpassed the deaths because of HIV in 2014. 10 million cases per year are attributed to the TB infection, where more than 3 million never get diagnosed and treated, and less than 25% are recognized as the rifampicin resistant or resistant tuberculosis. If we see at the incidence of TB globally, in India, we have around 181 per 100,000 population, and it is the same age area where the BCG coverage varies from 95 to 99%. With the co-infections, HIV and TB, they are strongly linked with 1 in 3 HIV patients who have died in 2015 because of tuberculosis. Over the last 17 years, the annual trend of TB/HIV burden in India has slowly gone down. However, there are about 10% of PLHIVs who still suffer from active tuberculosis. As we see here, there is a gap in TB detection and TB prevention for people who are newly enrolled in HIV care. This is data of 2017. A gap of almost 10% is seen over here. Our center paper, which was published in BMC Infectious Disease, shows the overall TB incidence among HIV-infected patients to be 3.94 cases, and among the first-line ART patients, it was 4.39% cases per 100% years. When it was compared with the second-line ART patients, it dropped down to 1.64 cases per 100% years. Similarly, a paper that was presented at TB Union Conference in 2018 on children living with HIV, we found the overall incidence of TB to be 2.8, predominantly in the age group of 3 to 5 years, where it went up to 4.6. Looking at the recent data of TB India report regarding pediatric TB/HIV, out of the notified cases of 151,000, nearly 71% had their known HIV status known, of which 1% of them suffered from tuberculosis. Now, what are we talking about? In India, we have 2 national programs, the National TB Elimination Program and the National AIDS Control Program, who are running parallel. However, there has been collaborative interventions at various levels, starting at the national, state, primary care level, as well as community-based. These are 2 different diseases, but the patient happens to be one, and hence these integrations are very important. As we see here, one of the models which shows from low complexity to high complexity, where when the 2 programs function separately, they are easy to manage, whereas as they start integrating, you will see that more and more complexity occurs. These are existing in India, where the linkages, clinical linkages are available at the TB services and HIV services areas.